Hello everybody, happy Friday. I'm sorry for the weird lighting here. I just wanted to pop on because I've been meaning to get on and share about this all week and I just completely forgot. But this is the time of year that RSV, which is Respiratory Syncytial virus, is super prominent. Typically from October to March is like the peak season for RSV. So this is a respiratory illness that looks typically like a cold in older children and adults, but in younger children can actually cause quite a bit of respiratory distress. But I kind of wanted to buffer how the news is kind of making this like a really big deal. Like it's out of the norm. It's not out of the norm, you guys. Like every 3 years, there's a bad year for RSV. And then the other 2 years in between are typically normal years. But that third year tends to be just a harder, more difficult year where it's taking longer for kids to recover. They may have more respiratory distress than the years before, or we're simply just getting more cases. So this was the most common respiratory illness that I saw in the hospital. And we just got really adept at taking care of it. So with respiratory syncytial virus, because it is a virus, there is not an antibiotic that will do anything for that. The only reason that an antibiotic should or would be prescribed for a child with RSV is if they developed RSV and pneumonia. So a secondary infection from the initial infection. So RSV, if you think about it, you have these tubes that go into your lungs, and then you have even smaller tubes that get into what are called the bronchioles. So they're like these little tiny sacs that fill up with air when you breathe in. They're very small, but those sacs actually get filled with mucus, and it can cause a lot of respiratory distress. And if you didn't know this, there are little tiny hairs lining your airway all the way down to those bronchioles. That's called cilia. And those cilia are meant to move the mucus up the airway and out. And so that's what triggers the cough reflex to cough stuff out, okay? So that is a normal process. But what happens with RSV is that the bronchioles get filled with fluid, and there is just so much mucus that it's hard for little kids' respiratory systems to tolerate it. So typically, we saw this, being worse in children under the age of 4, meaning that we would often see retractions, which is where in between the ribs is pulling in, or even you can't really, let's just see if I can get it better. If you see pulling right here, this is my clavicle, so like a pulling here. I will post a video because it's really important to see, those are the times when you'd want to take your child into the hospital. But for most children, we can support this by keeping them well hydrated, avoiding all forms of sugar and dairy, because those will increase the mucus production, making it a lot harder for them to get on top of the illness. What else do we do? Sometimes oxygen is required if there's a lot of mucus that's going on, and suction. So for younger children, suctioning is really, can be very beneficial. The tricky part is that over-suctioning, so if you're suctioning too much, it can actually cause swelling of the nares or the nose and make it harder for them to breathe. So you just want to be moderately, keeping up. If you're noticing that they're struggling, suction them some more, give them lots of fluids. And then obviously there are some homeopathies that you can give to support their breathing. I will try to share a little bit more about that at a different time. I'll try to write something up for you guys. But really, you're wanting to support the body's ability to clear the virus. So some things that you can do are things that I've posted about before, but things like warming socks, where you put a damp, cool socks on the bottom of their feet, covered by dry socks. And what that does is there's a bunch of reflex points on the bottom of your feet, and it will actually stimulate not only the immune system and those fighter cells, but it will stimulate the lungs to release stuff a little bit easier. Alexis used to get croup from RSV all the time when she was younger. Probably got it from me bringing it home from the hospital. And we would actually do like a wet t-shirt covered by a dry t-shirt because she would get so sick from it. And so I don't recommend that for most children just because it's really uncomfortable, but absolutely warming socks would be the hands down the first thing that I would do. Having them sleep propped up or in a room where you can hear them, absolutely. Getting a good suction, the nose Frida is amazing. And it's not weird at all because there's a little filter in there, so you're not going to get any boogers in your mouth or anything. And then I'll post a video if I can find it of what to look for in their breathing that would tell you whether or not you want to take them into the hospital. So the first thing is counting their respiratory rate, which is how many breaths in and out they are taking in a 60-second period. So literally you can just set the timer on your phone and count those respirations. That's going to be really important for your doctor. If you have to call them for any reason, they're going to want to know how fast they're breathing. If, you know, they're really lethargic, arousable, things like that your physician would want to know in case of an emergency. But I just wanted to share with you, if you're seeing all of the news about RSV being bad this year, that's pretty common. Especially because people were pretty much indoors the last 2 years. So it's not totally surprising, also not outside the norm. And really you're just going to support it like you would any respiratory virus. So I hope that this helps. Have a great evening, you guys. Talk soon.